Medically unexplained chronic multi-symptom illnesses. These are listed as examples: chronic fatigue syndrome, fibromyalgia, and IBS. You have to make sure you have all the proper testing done before you file these claims. You make sure you point out the proper testing was done, and you have to make sure you have a proper diagnosis with these. Make sure it's done by an expert in the field, not a nurse practitioner. Make sure your diagnosis for chronic fatigue syndrome is done by a doctor there. You don't get a diagnosis from a psychiatrist. Psychiatrists cannot diagnose these illnesses. Make sure you have a GI doctor who diagnoses you for IBS. Make sure when you write your statement in that you point out that it was a GI doctor who's an expert in the field to diagnose these. Make sure you do it 3148. Make sure you do statements in case about your symptomologies. Please read the guide on that. CMIs of partially explained etiologies are not allowed under the law. Diabetes, multiple sclerosis was specifically addressed when this was passed in the legislation. And that you will find that within the Federal Register. You'll also find it within the CFR. Fibromyalgia, the only requirement is widespread musculoskeletal pain. That means in the upper, lower, left, and right of the body. Secondary to fibromyalgia, you need a doxor nexus: headaches, numbness, tingling, bowel, bladder. IBS has its own diagnostic criteria, but you can also get a nexus to that because sometimes the VA wants to put it underneath it as part of it. GERDs maybe, but remember, if you have IBS at 30%, if you do get GERD service connected, it's a 0% anyways. Symptomology, if they say that your depression is secondary to the pain from IBS, or if your pain from fibromyalgia, you can get depression secondary to, or anxiety disorders. Chronic fatigue syndrome, debilitating fatigue, which is not caused by any other factors. IBS has exclusionary criteria: cancer, inflammation, Crohn's disease, ulcerative colitis, alcohol abuse. These are exclusionary factors that if they find these in your records, you have to rule these out with tests before you can have the diagnosis and before you file the claim. These found in your records will cause the claim to be denied. Medical evidence. Medical evidence of a non-diagnosed illness includes, but as per the law, time lost from work, sick reports, lay statements from the boss, supervisors, and private messaging through the e-benefits to your notes, patient notes on treatment that you've tried and hadn't worked, x-rays and medical reports trying to diagnose the illnesses and were not able to. Medical evidence of observed symptomologies. These are the different court casings holding that a layperson is competent to provide information regarding visible and otherwise observed symptomologies. This comes especially important in a claim for skin disorders because some VAs just don't want to use your evidence saying that here are photographs showing the skin is obviously covering more than 40% of my exposed skin or exposed parts of the body. These court cases come are very important in these areas. Medical evidence of an inadequate exam. A medical examination is considered inadequate if it fails to consider competent lay evidence. That's if you have an IBS claim and when you filed it, you put in there how you have severe abdominal cramping and everything every day, and you go to the restroom 5-6 times a day, like every day or every other day, with severe diarrhea, and your medical reports show that you are always having diarrhea, and they tried different medicines and fibers and everything like that, and none of it's been working, and they don't take that, and the examiner says, well, there's no evidence that you have diarrhea. They didn't take the medical statements into consideration. That's an inadequate exam. Same thing with in actual factual premise. If you have fibromyalgia and you've been going into the doctor on this and he diagnosed it and you had the symptomologies for 6 years before in your medical records, and then the doctor says you've never been diagnosed with fibromyalgia in the examination, that's an inadequate examination that was not based on medical factual evidence, and that exam is not of any probable value and should never be considered in the rating basis. And you have to address these from day one before you even go to the board. Okay, a good service officer will know this, and you point these cases out and talk to your service officers. A famous court case for Gulf War things: a competent lay evidence has to be used. There's lower standards for Gulf War claims underneath this. Only if you have a properly diagnosed, undiagnosed symptomologies, or if you have a properly diagnosed chronic multi-symptom illness. Symptoms based by the wife and when symptomology started. You don't have to prove any of the exposures within these claims, and VSOs, you need to know about these. This is found within our guide. Okay, lay evidence is very important. Okay, lay evidence must be sufficient to establish service connection of symptomology, credible lay observations, for example, fatigue, joint pain, skin rashes, and so on. Undiagnosed illness claim. Here I talked about this earlier. Okay, decision must explain why one diagnosis is used over another. Diagnostic codes must take into account the nature of the unexposed illness. It's inappropriate to require objective evidence of a diagnosed disability. That is, like X-ray proof that your illness is there, or lab test that shows that you have the disability. Notice disagreement. Okay, my record shows that I am on medication for fibromyalgia. If you have a diagnosis of fibromyalgia and your records show that you're taking medication for it, that means you met the 10%. If your records also show that in your doctor reports that you're still refractive to the medication, otherwise that you're in pain almost all of the time, that means you're eligible for a much higher thing. And if the raters fail to utilize your records, okay, they fail to adhere to the principles of the law of 2004, or the court case of 2004. As a Gulf War veteran, my fibromyalgia is a presumptive. You need to put this within the NLD if they denied it, saying that it wasn't related to Gulf War. I don't need a nexus if they said that you needed a nexus to the service or it wasn't in your service medical records. Don't forget, you need a nexus for chronic multi-symptom illness as a partially understood etiology, or if it's a disease of clear and specific etiologies like sleep apnea, GERD, migraine.